Now, the rapid rise in flu deaths is likely to add to the controversy around how we should deal with the illness, with debate focusing on whether the flu vaccine should be given to all children under 5. As we reported earlier, today's official figures show what appears to be a dramatic rise in deaths in the space of a single week, from 50 to 112. But this is partly explained by a delay in confirming earlier deaths which were caused by flu. And where the age of victims is known, 6 were under 5, 79 were between 5 and 64 years old, and 16 were aged over 64. The majority of those who died appear to have been in the at-risk groups. We're joined now by the Chief Medical Officer, Sally Davies, and lots of you have sent in your questions via our website and Twitter. And I want to start, Professor Davies, with Paul Sutcliffe. Why does it take a tragedy to remind us we have not followed the example of the USA and provided vaccine to our under-4s?
We take advice from an independent scientific group called the Joint Committee on Vaccines and Immunisations. They gave us advice as general practitioners were ordering vaccine about who should be given the vaccine. They said we should give it to the over 65s because every winter the over 65s usually suffer disproportionately, and that the rest of our efforts as an NHS should be focused on the risk groups under 65. We've been working hard with GPs to get the risk groups vaccinated. The latest data we released today show that we've done as well as last year and the year before in the over 65s and in the at-risk groups, and importantly, in pregnant women, it's coming up well. Your
figures talk about 5 under 5s who've died, and of course the case of 3-year-old Lana has attracted enormous concern. Are you concerned? I mean, it does sound as if she had no underlying symptoms.
Well, of course I'm concerned. Every death is heart-wrenching, and that does sound very saddening. As a paediatrician, I've seen this, and it's awful. But there's a difference between being concerned about individuals and public health policy. And when the JCVI came together at my request between Christmas and New Year, because the infection rate seemed to be going up in the under 5s, they reconfirmed that their policy advice stood. And if you look, as you say, at those who are dying, most of them are in the at-risk groups. So we have to focus our efforts there.
Well, I've no way of knowing whether this question is right, but the issue is, did the Americans come to different conclusions when they decided to go for under 4s?
Well, the Americans are unusual in the Western world in having a recommendation that all people can have the vaccine, but then they have to go off and buy it. What we do in the NHS and other countries in the West generally are deciding where we're going to put the vaccine. And for us in the NHS, if you're in a risk group, you go to your GP, you get the vaccine and it's free.
What are the main symptoms, ask Aaron Radio, of the flu and the difference between swine and seasonal flu symptoms? I mean, actually the whole thing is all bound up together, isn't it?
It is. I don't think that as a patient
you'd ever know.
You'd know the difference, no. So the usual symptoms of flu, high temperatures, muscle aches, feeling rotten, sometimes headaches.
There is another question as to whether this year's strain is different from last year's strain.
There's no evidence. The Health Protection Agency keep an eye on that for us. There's no evidence at all of significant genetic drift.
And that was another question here, which is as to whether it's therefore absolutely okay to have issued last year's vaccine.
We took advice on that, and it is okay. It's still effective.
How and why does flu become pneumonia? Is it becoming pneumonia that kills people?
Most deaths do relate to pneumonia, but there are 2 reasons. One, the flu virus itself can attack the lungs, but the other, particularly in the older people or people with lung problems in advance, is that they get bacterial pneumonia because they're in a weakened state.
A tweeter called Post-Culturist asks, what are the usual winter flu death rates, and do this year's rates deviate from the mean in any significant way?
The normal way we calculate death rates are excess death rates, and then it's usually around 10,000 that we attribute to winter flu. This is the first year we've tried to pick up deaths that can be attributed to flu and verify them, so we can't compare them, except with pandemic flu, and 474 deaths were verified.
If you have it once, can you have it twice?
Well, you can't have exactly the same flu strain again, but you may have had the other flu strains that are circulating, or a very nasty cold you thought was flu. So don't think you're protected because you've had it if you haven't had the vaccine.
Can you catch it in a swimming pool? What an extraordinary question.
Well, you can
catch it anywhere.
Catch it anywhere, yes.
I mean, we keep going back to under fives, which were partly because the tabloid front pages are very much concentrated on this. Why healthy under fives deemed at risk last year, but not this year? Has the virus threat changed, or our ability to meet it?
Probably we would argue our ability to treat it. What happened was last year we didn't know how the virus behaved, so we gave the vaccine as soon as it was available to all children who came forward. At the end of last year, we knew that there was immunity in children in London of about 62%, around the rest of the country 45%, so our independent scientific advice was that that should be protective, but we need to treat or vaccinate the at-risk children.
My 3- and 1-year-old kids have had flu for 3 days. They are getting better, but I would have got the jab for them had it been offered.
If they were at risk, I wish you'd gone, but I'm glad they're getting better.
Well, there's no evidence they're at risk, but I mean, her concern really is that they're 3 and 1 and have had a bad bout of it, and that she would have gone if it had been offered.
Yes.
I mean, are there side effects from it which in some way make you dubious about wanting to give it to them?
No, there's been a lot of use of both the seasonal flu vaccine and the H1N1, and there's a very good safety profile. It is the independent advice that we've taken that has guided us to focus on those most at risk.
Well, thank you very, very much, Professor Davies, for allowing me just to throw these at you, but thanks very much. And thank you very much for tweeting in your questions, because they've helped, I think, to educate us all. Thank you.